Do you feel pain in your cheeks or in your teeth even though you've been told that structurally everything looks normal? Does your jaw feel stiff during the morning? Or do you sometimes feel the pressure in your ears or maybe even faint buzzing sound? And maybe you're wondering, where does this actually coming from? Most people immediately think that the problem must be the jaw joint, but often the real cause is somewhere else. There is one powerful muscle in your cheek called the masseter, the main chewing muscle. This muscle does the most of the work whenever you bite your teeth together. And when it comes overloaded, it doesn't just cause pain locally. It can refer pain to the teeth, to the temple area, or the area front of the ear, and sometimes even cause headaches. In this video, we'll go through 3 things. First, I will going to show you what typical masseter muscle pain feels like, and where do you feel the symptoms. Second, I will going to teach you a simple test what helps determine whether the problem is coming from the muscles or the jaw joint. And third, I will going to give you a clear plan what to do next. Because once you understand what most likely is causing your symptoms, then the guessing stops. And when the guessing stops, the treatment becomes way much clearer. What is the masseter muscle and why it can cause these strange symptoms? The masseter is actually one of the most strongest muscles in human body relative to its size. So why can the symptoms of its cause feel so strange? And where exactly can those symptoms appear? Pain can be shown up in the sinus area, around the ear, or in temple area, or even in the upper or lower teeth. Yes, this muscle can make your teeth feel sore, even when everything in teeth themselves are structurally normal. Here you can see image showing the typical trigger point referral pattern of the masseter muscle. So how do you interpret this image? The more marks you see in certain area, the more people have reported feelings of the symptoms in there. And those crosses you see in the image show the points where the muscle itself was pressed. So when you apply the pressure to the upper, middle or lower part of the superficial masseter, the symptoms typically refers to these areas. When pressure is applied to the deeper part of the masseter, which lies underneath, the symptoms often radiate towards the ear. And as you can see in the image, the lower right corner. Now, if your underlying problem is ischemic muscle pain, meaning that the muscle is simply been working too hard, certain patterns often appear. Opening of the jaw during the morning may feel stiff. When eating tougher foods, the muscle may get fatigued very quickly. And the symptoms often worse after the eating or after the night of sleep. Why the symptoms sometimes can appear in the ear area? Let's look the anatomy of that part. Here we have the base of the jaw joint, and where the upper part of the jawbone sits inside its socket. Very close to this area there is also a small opening that leads into the skull. And through that opening travels part of the pathways related to our hearing. So these structures sit very close to each other. Between the jawbone and the base of the joint there is an intervertebral disc. And from that disc runs a ligament that connects towards the ear canal. So if there is a tension or irritation in the jaw joint, that ligament can be also transmitting pulling sensations towards the ear. If you want to feel this relationship yourself, try this simple experiment. Place the tip of your little fingers gently into your ear canals. Bend your little fingers slightly so the tip points towards your nose, towards the midline. Now slowly move your jaw. You'll probably feel the movement of the jaw joint also inside the ear area. So how to test whenever the symptoms come from the muscle or the joint? For this test you will going to need wooden ice cream sticks or medical spatulas. These are the same sticks what doctors use when they are examining the throat. Break the stick carefully so there is no sharp edges left. Then stack 2 or 3 pieces together. This creates small bundle what is several millimeters thick. And now let's imagine that the pain is at the right side. Place the bundle between your upper and lower teeth to the right side. Because the teeth no longer fully touch, this slightly increases the space inside the jaw joint on that side. And now gently bite down. In this situation, the muscles are doing the most of the work. And if this makes your symptoms to the right side worse, the problem is most likely muscle related. Now let's test for the joint problem. So if the pain is still at the right side, place the stiff bundle to the opposite side to left side. Now when you bite your teeth down, the teeth of the left side remain separated because of those sticks. That means the pressure increases much more on the right jaw joint. Now bite your teeth together. If this reproduces your familiar pain, it's suggested the problem is coming from the joint itself. What should you do next if your jaw has these symptoms? If the symptoms seems to come from the muscle, self-care is usually appropriate. Doing the exercise once per day is enough as long as it targets the right structures. The intensity of the symptoms begins to calm down. Now you're moving to the right direction and you need to get the path going down and down and down. And once you have had 7 pain-free days in a row, then you can drop those exercises off. Or if you have some issues present, then we need to figure something else. If you noticed significant tooth wear or tooth is really sensitive and the test suggests joint-related issue, I strongly recommend discussing the bite splint with your dentist. You should also check the jaw mobilization video, link it in the down description below. However, if you have trauma on the background, or if your jaw locks, or the pain becomes severe or unusually high, it's important to seek the help from the professionals. In the next video, I will going to show you exactly how to relax and calm the masseter muscles properly. The follow-up video will going to appear in here within 2 weeks.